Yes, squeezing or picking at blackheads can potentially lead to scarring. When you squeeze a blackhead forcefully, you apply pressure to the surrounding skin, which can cause trauma and damage. This can result in inflammation, redness, and even breakage of the skin, leading to scarring. Additionally, improper squeezing techniques or using unsterilized tools can introduce bacteria into the skin, increasing the risk of infection. Infections can further complicate the healing process and potentially result in scarring. It's important to note that scarring varies from person to person, and some individuals may be more prone to scarring than others. Factors such as skin type, genetics, and the severity of the trauma can also influence the likelihood of scarring. To minimize the risk of scarring and other skin complications, it's generally recommended to avoid squeezing or picking at blackheads. Instead, consider gentle and non-invasive methods to treat blackheads, such as using over-the-counter topical treatments containing salicylic acid or benzoyl peroxide, exfoliating regularly, and maintaining a consistent skincare routine. If you're concerned about blackheads, it's always best to consult with a dermatologist or skincare professional who can provide appropriate guidance and recommend the most suitable treatments for your specific needs.